I'm Giovanni, I work for GARDP. I'm in charge of the programs, and I will present the Antimicrobial Memory Recovery Program and the Revive Hub. The outlook, I will explain what GARDP is. I will talk about the Memory Recovery Program. I will show you what the Revive Hub is. We'll talk about collaboration, latest news, and a summary. I mean, the challenge, you have two challenges. I'm the only European talking here, so get used to my accent very quickly. The second, I'm Italian, so the wine is pretty important for me, so I will try to make it. So GARDP is a global antibiotic research and development partnership. It's a not-for-profit organization. It's a virtual organization that will develop new treatments for bacterial drug-resistant infections. It's a joint venture of the WHO and the Drug for Neglected Diseases. We are based mainly in Geneva, although we have people also in the US and other countries. And we are today 19 people. It's important to say, at the end of December 2016, there were only 3 people part of GARDP, so the team grew quite a lot. We have ambitious objective by 2023. We want to develop 4 new treatments, either via improving on existing antibiotics or developing new chemical entities. We want to build a robust pipeline of preclinical and clinical candidates. And what is very important, we want to support appropriate use and access of new antibiotics. Our business model, as I said, is a virtual R&D organization. It works through partnership and collaboration with different stakeholders. Our funds and resources will be invested either in R&D programs that we drive fully and we fund them, or via partnership in which GARDP brings funding, direction, and support, and the other part brings the other 50% of the effort. We have R&D capabilities in-house. We have capabilities for clinical trials, CMC capability, just discussed it right now, and regional networks. We have expertise in developing programs. All our program and our R&D strategies is based on TPPs. And what is very important, all our programs have 2 main points. Number 1, the patient delivery is the end of the line on a global level. We are as I said, a joint venture from WHO, so the end of the line is a patient on a global level. And the second one, we want all our program have sustainable access strategies embedded in the project. Today, we have 4 programs. Neonatal sepsis, sexual transmitted infections, pediatric antibiotic platform, and the program I'm going to explain right now, the Antimicrobial Memory Recovery Program. So what is it? The memory says it all. We want to recover withdrawn, abandoned, or forgotten molecules, things left behind. For any reason, company failed, they've been left behind, merged, competition was at a certain point, more advanced, so molecules have been left behind. We want to look at them. We want to repurpose them for key areas, which are sexually transmitted diseases, global pediatrics, and neonatal sepsis. We want to address escape pathogens that cause serious bacterial infections. Because it's a memory recovery, the key focus of this program is building a group of experts that they can help us in retrieving these molecules. So what are the goals? By 2023, we want to build a global leading panel of world experts in antibiotic R&D and antimicrobial resistance. We want to develop 1 to 2 new chemical entities and bring an other to preclinical or clinical stage. And we want to champion a new generation of investigators in antibiotic R&D. So it's a transfer from the memory into the new investigators. We have 4 working areas. One is Ask the Expert and the Revive Hub, and I will present it right now. We want to start from 2018, we're going to work on an antibiotic R&D toolbox, so providing tools to new investigators. We want to bring all this background knowledge and making it available to everyone. And then, on the long term, building a portfolio and upstream research. So who are the experts? The experts are a group of professionals that will support, retrieve, and federate the know-how in antibiotic R&D. We have key opinion leaders, which are experts, the long-standing career in antibiotic R&D. They will support and guide GARDP. Some of our experts and key opinion leaders are actually scientific advisory committee members of our group. We will identify suitable molecules and suggesting new programs, and also support new investigators in working and coming in antibiotic R&D. And then we have a group of anti-infective specialists, as we discussed before. There's so many specialties in drug development. They have a long career in antimicrobial-related disciplines. The role is to support new investigators and promote the role of GARDP. We ask about 400 people worldwide to support us in this project, and we have more than 120 people who say they will support us. We have 124 experts out of 26 nationalities and counting. So we are looking for names, we are looking for people that they fit the KOLs or the specialists. And as we discussed before, we need different disciplines. So we have biochemists, chemists, CMCs, drug development, clinical development, medical background, microbiologists. Half of them are from academia, or at least they have an academic title, but they're also involved in different work. And about 1/3 are industry, so people working for industry. The second piece of the puzzle is the Revive Hub. So what do we have? We have experts, we have new investigators, we want to recover the memory, we want to have an educational role, so we design the Revive Hub. The Revive Hub connects all the dots together. The first point, it's a forum discussion area, which is open to everyone. People can read what's happening, can read the topics, participate, making questions, asking for specialists, asking for consultants. We have the biography of specialists and key opinion leaders. The Revive Hub has an educational role. This workshop today, together with Carbex, is part of this educational role. So we're going to have online all this information. We want new researchers in antibiotic R&D to be part of this hub, promote topics, talk about it. We design a one-to-one confidential area. It was exactly the question was asked before. How do I find an expert in regulatory, in a certain area? You can ask the hub, and you can be put in contact with some specialists in a one-to-one confidential way. And the last one is, of course, collaboration, links to other organizations. So the way I thought we're going to show you is with a video, which probably is going to start. So this is our hub. It goes live in a few weeks. We are concluding the beta testing, and we'll be open. We're going to do a webinar where we're going to launch the hub. So we're going to invite people to our webinar and see live how the hub looks like. A key component of our work is collaborations. Together with John Rex, we start working in May on all of this. We have a list of workshops and webinars that we are developing. We anticipate to do 5 to 10 per year. Will be divided in early discovery, late discovery, translation, regulatory, pretty much what you saw today. Today is the first one. We're working already on the schedule 2018 and 2019. We like to expand the list, as John explained at the beginning. If you have a suggestion on way of doing this webinar, on way to do with the workshop, we're happy to listen. And so please talk to us. We are also working with other collaboration. I spoke with Dr. Laura Piddock, and we decided to present today Antibiotic DB. Antibiotic DB is a web-based Google-type database of antibiotic. The website is over there. It's been supported by the British Society of Antimicrobial Chemotherapy and Antibiotic Actions. There are over 1,000 antibiotics in this database. It's been all cured and verified. You can find information about mechanism of action, spectrum, development, links to key papers. The user can submit own molecules, which will be tested, cured, verified, and put it online. And also, we are working on other organizations like Pew and the Foundation Maria. And finally, where we are today, I mean, if you're new for some of you, we finalized our first partnership in July. GARDP and Entasis will develop together soliflodacin for gonorrhea, drug-resistant gonorrhea. Is the first partnership. As I said before, in the partnership, we come together with a partner to develop a molecule which has the end user, the patient, our target. And the latest news from yesterday, because you cannot do anything without money. Yesterday, there was a press release at the German Ministry of Health in Berlin, where GARDP has been, will be funded by 56 million euros, supported by Germany, another 6 countries, and the Wellcome Trust, which clearly gives us the possibility and the funding to continue our work. So where are we today? What are we doing? We're going to launch the Revive Hub in a few weeks. We're going to do a webinar. And then together with Carbex, we have a long list of events coming up. We're going to be at the Gordon conference in March, in late March. We're going to be at the ECCMID in Spain. We will be at the Microbe, and we're going to be also at the meeting in Vienna in late September. So for each event, we were going to organize a workshop. We would like to have your feedback from. If you want to see a workshop like the one today, roundtable, live webinars, we are open to develop all the topics the way you would suggest. And to finish, we launched the Memory Recovery Program. We have established a pool of 124 people, and I would like to thank you everyone personally for the help that you're giving to us. We are launching the Revive Hub in a few weeks. We established collaborations with several organizations. GARP signed the first international partnership on a new chemical entity with Entasis. And finally, we secure funding. And with this one, I want to thank you. Thank you for the day. I think it was a great meeting today and workshop. And I thank you everyone for supporting the workshop between Carbex and GARP. Thank you.